What is angiography? Angiography is an imaging test that uses X-ray to view your body's blood vessels. The X-ray provided by an angiography are called angiogram. An angiogram is a diagnostic test that uses X-ray to take pictures of your blood vessels. A long flexible catheter is inserted through the bloodstream to deliver a contrast agent into the arteries, making them visible on the X-ray. These tests can help to diagnose a stroke, arteriovenous malfunction, tumors, clot, and arterial stenosis. An angiogram works similar to an X-ray. The body casts a shadow on a film when it is exposed to the X-ray, much like when you hold a flashlight up to your hand and a cast shadow on a wall. Normally, your blood vessel cannot be seen in an X-ray, but by adding a contrast agent into the normal bloodstream, make your arteries and veins visible. Contrast agent contain iodine, a substance that cannot pass through X-ray.
In this video, it will shows on how the catheter is inserted into the artery for cardiac catheterization. A fluoroscope machine called a C-arm is an arc-shaped piece of equipment that generates X-ray from one side and photographs them on the other side. There are two ways on how the catheter is inserted. The first one is inserted from the artery in the arm and the second way is inserted from the femoral artery. To deliver the contrast agent, the catheter is advanced from the femoral artery in the leg. Contrast agent is injected into the bloodstream to make the blood vessels visible on the monitor. The doctor steers the catheter through the blood vessels while watching a monitor. The result is a kind of road map of the arteries. After finish the procedure, the catheter will be removed from the artery.
Next is, what is the SPY angiography system? The SPY angiography system has several surgical uses. Often surgeons may experience difficult cases in which the viability and perfusion of tissue is questioned. By using the SPY angiography system intraoperatively, this system may provide additional information, allowing the surgeon to make calculated real-time decisions which may lead to improved patient outcome.
This video shows the SPY angiography on the wound of leg. The SPY laser will focus on the skin flap of the wound. It will produce live image of blood flow onto the screen. In the screen, at the middle part, it is shows poor blood perfusion on the skin flap.
After seeing the previous video, there are another case of a chronic sternal wound created with reconstruction using intraoperative SPY angiography system. Inadequate perfusion of the flap was determined via SPY angiography system intraoperatively. The flap was thereafter successfully utilized to cover the chronic wound. The patient was followed post-operatively with progression of wound closure. Sternal wound often pose a complex problem for patient and physician. The use of intraoperative spy angiography system provided critical information to the operating team, allowing for them to successful identification of a viable flap. The use of spy angiography system provided the patient an opportunity to achieve a successful outcome and reduce the risk of skin necrosis or reoperation.
In this part, it shows the sternal wound after bypass surgery on the left side, while on the right side, it shows the deep sternal wound infection. Chronic wounds are complex and often do not heal according to the phases of wound healing. When a chronic wound is large or fails to heal with assistance from a wound vacuum assisted closure, a tissue transfer may be considered. Perfusion is the top priority for a surgeon when assessing flap viability. Although clinical exam may provide some information, accurate assessment of blood flow is critical to determining the status of the flap. By using SPY system, it allows for the assessment of blood flow to a flap in real time. In the conclusion, SPY angiography system is very helpful for determining flap perfusion on a patient. Through the use of the SPY angiography system, successful identification of adequate perfusion of tissue may increase the chance of positive outcomes in complex wound reconstructions. Thank you for watching.